in pain management, there are two types of injections. One is a diagnostic injection. This is an injection that gives us information about a patient's condition. The other type of injection is a therapeutic injection. This is an injection that is done with the purpose of treating the pain. Also, there is a third one, which is a diagnostic and therapeutic injection, but we're not going to get into that right now. Let's just stay with the first two to keep it easy and simple. And it sounds pretty simple, right? One is a diagnostic injection, one is a therapeutic injection. One tells you where the pain is or isn't coming from, and the other one helps treat the pain. But yet you would not realize the level of miscommunication that occurs between pain management doctors and patients regarding even this issue. And I think the miscommunication is due to the fact that neither party is actually listening to each other in the examination room. And this miscommunication is due to several reasons, and both parties are to blame for this one. So what happens is the doctor begins to explain the injection to the patient, but oftentimes uses words and concepts that go way over the patient's head. Not because the patient wouldn't be able to understand it, but simply the patient does not live every day of their life using the same jargon that physicians do. And so doctors need to speak at a level at which the patient can actually comprehend what they're saying and check in with their patient from time to time to make sure that the patient is understanding. On the part of the patient, there needs to be a little bit more active listening so that they're able to ask appropriate questions and that they're able to then assess what it is that the doctor told them and see if they're in agreement or disagreement with it. The problem is that a lot of patients walk into the pain management office with a preconceived notion of what they are going to be getting out of that office visit. And a lot of times patients are in a significant amount of pain and just want the pain to go away. And so when the doctor tells them about an injection, they automatically assume that the injection is to take their pain away because their doctor is knowledgeable and is going to solve their issue. However, especially in the first few visits, the doctor is generally still trying to establish a diagnosis and is oftentimes at a loss at knowing where the pain is coming from. And it takes time and teamwork to figure that out. So high expectations on the patient side combined with poor communication from the physician side is the reason why patients sometimes don't understand what type of injection they're getting. And when patients don't understand what type of injection they're getting, it leads to a common complaint. And the complaint is, doctor, the injection did not work. Oftentimes, the injections that we do in pain management are simply to see if the pain is coming from a particular site. So, if the pain relief lasts a couple of hours, that actually gives us a lot of information, especially when the injection is a diagnostic injection, meaning we're trying to simply figure out the cause of the pain. Hope this was helpful. That's pretty much it. All right. Thank you. Bye-bye.